All right, so I think we're going to go ahead and get started. Again, hello everyone. Welcome to the Health Equity Community Collaborative's Community Gathering, building upon our movement. I am Jacqueline Dalton, the director of the Health Equity Community Collaborative, and I'm pleased to be serving as our moderator for the virtual gathering today. Before we begin our conversation, I'd like to introduce our interpreter, Enrica. Enrica will be providing a live Spanish interpretation throughout our webinar. To access the interpretation, please click on the interpretation icon, which is the globe icon at the bottom of your screen, and hit the ES Spanish option. And on the other hand, if you are listening to the English version of our virtual gathering today, you might want to click on that icon and hit the EN or English version. So again, it's the globe icon at the bottom of your screen in order to access that interpretation. Great. So as you do this, and I already see some of you jumping into the chat to introduce yourself. So please do feel free to introduce yourself in the chat with your name, maybe preferred pronouns, your organization, and maybe even where you're joining from today. We'd love to know. A few housekeeping things that I want to review before we get started. Today's virtual gathering will be recorded, so no need to ask. We will be sending that out to everyone who registered and uploading it also to the Health Equity Community Collaborative website. During today's session, we'll try to answer as many of your questions as possible. So please submit all of your questions using the Zoom chat feature to share comments as well, maybe even reactions and links to our fellow attendees as well as panelists. And we also have closed captioning available to help you if you'd like, if that'd be helpful to you. To enable closed captioning, please click on the CC icon at the bottom of your Zoom screen. Today, we'll be launching a few polls throughout this session, as well as at the end, there'll be a little session evaluation that pops up on your screen. So if possible, please be sure to just hang around at the end to fill out that evaluation as well. Great, and I see we have folks joining from all over, Colorado and Oregon and Ohio, New Jersey. Thank you. So please keep those introductions coming. Now, let's talk about the evolution of our work, right? How did we all get here today for the Health Equity Community Collaborative? The work of the HECC, which we do call HECC and not the HECC, right? The HECC emerged from efforts of the Vaccine Equity Cooperative as well as the Community-Based Workforce Alliance. These initiatives really laid the groundwork for what we are calling HECC today. And it began as a way to really convene and sort of overcome the local and national challenges that we were faced with during the COVID-19 pandemic. It was also a way for us to continue to uplift community-based workforces through engagement and resource sharing and collaboration. And so as you see on your screen in a moment, you'll see some of the things that we have launched out on our Health Equity Community Collaborative website. And what you're actually seeing on your screen right now is what we plan to talk about today. So you'll hear a little bit more about our vision for HECC. We'll brainstorm together and focus on some of the health equity challenges. And really, we are really wanting to hear from you all about what are the top priorities that you're focused on at this moment. And we'll get into some discussion about what is this work that we're in this space that we're trying to create for the HECC mean to you. And so as I was saying, we do welcome you to visit our website at www.healthequitycommunitycollaborative.org to review our mission, vision, and strategy of the HECC. You can learn more about our core partners, who you'll meet a few in just a moment. And these core partners are really essential to this collaborative because they help to sort of guide and solidify the strategy of the collaborative using feedback and the feedback and input from each of you, right, members of the collaborative. They've worked diligently behind the scenes to bring HECC into fruition. And, additionally, we will also encourage you to sort of look at the bottom of the page at the website to subscribe to receive the HECC newsletter or you can also follow our page on LinkedIn. And that way you'll stay up to date on virtual events like this one, other activities that we are planning as we move forward, and just get new information as it becomes available. So going back to our slides, thank you. One thing that has become a standard for our work with HECC is really establishing practice agreements. And as we jump into some discussion and dialogue today, we thought this was really important to share out at the beginning of our session, give you some time to read them, allow them to sink in before we jump into our breakout discussions and have conversation with one another. So we want to invite you to try your best to uphold these agreements when you go into your breakout sessions today. One, we want to create space for all participants to be present and participate. So just being mindful of maybe all the people in the room, they will be probably larger groups. So we do ask you to use the raise hand function and just be mindful of sort of the time that you're taking to share as you're sharing your comments so others can also share. We want to just be open to acknowledging systems of domination like racism and capitalism, patriarchy and colonialism, and the ideologies and norms that they maintain, like white supremacy, inequality, heteronormativity, or this idea of promoting heterosexuality as the only norm or preference for everyone. And cis centrality, meaning that everyone or everything is really centered around two or cis genders. And essentially, we want this to be a space or a conversation for everyone and for all the identities that each one of you is bringing to the table today and into this space. So we want to be welcoming and affirming. We want to hold space for tension because it's definitely okay for us to have differing or different viewpoints, which really helps to enhance our collaboration and to make it a better inclusive space. We want to hold each other accountable to these agreements, whether we're hearing things that might be intentionally said or maybe unintentionally mentioned. We want to be curious and be kind to one another. And essentially, what this whole collaborative is about, we want to foster belonging and healing throughout our time together today. So, and you will continue to hear this idea of belonging and really feeling accepted, and the idea of well-being and healing collectively. So we want to try to model that in our conversations today as well. So these are really for the breakout rooms, which are happening just a bit later. So we'll use them later, but please remain on mute and continue to use the chat function until that time. Okay, so we can go on to the next slide. Yes. Now let's take a look, or actually what we have planned today is we're really jumping into a conversation, and I'm just going to introduce a few of our core partners who will be speaking with us and also facilitating some of our breakout sessions later on. These are brilliant people that I've had the pleasure of working with quite often. And so first we have Rishi Manchanda, CEO of Health Begins. We also have Denise Octavia Smith, Executive Director of the National Association for Community Health Workers, also known as NACHWA. And we also have Alexandra Quinn, CEO of Health Leads. So welcome to each of you. So I know and have heard firsthand how each of you are really extremely excited about the opportunities ahead for HECC, as I am. And we really want to hear from you about what this moment means and what it represents for you. One of the concepts that has come up so frequently leading up to our launch, and I just mentioned it a moment ago, is really centering around this idea of belonging. Especially when it comes to doing health equity work, the idea of feeling like you are a part of something that is bigger than yourself and being a part of a group, really feeling accepted, right? And it's becoming increasingly critical, not only to health equity work, but I think in our nation and our world more broadly. So to begin, I want to invite Rishi to discuss the current threats to belonging and why is it so critical to address these threats now within our communities? And how can HECC play a role in restoring a sense of belonging? Rishi, I'll pass it over to you.
Thank you, Jacqueline, and thanks to everybody for joining today and for this conversation. I'm feeling the energy right now and really excited about it. I'm Rishi Manchanda. I'm CEO at Health Begins and a proud core partner for the new HECC. Um, as many of you are probably feeling or experiencing, especially in recent months, there's a lot of concern about threats to advances in health equity that we see at the local level, in our communities, in our institutions, and certainly at state and federal levels. There have been more and more threats to this. And the reason that feels acute to me personally in this moment, and why I feel like it's important to belong to an organization and to this new coalition of HECC, is because of all the promise that's been made recently. There have been enormous strides made in recent years, especially if we look at the ways in which healthcare equity has been a focus of late, the progress made in being able to expand social services and programs, especially integrating healthcare and social care as well, the opportunities for more people to focus in on not just the social needs of individuals, but the larger social and structural drivers of health equity. More now than ever, I find myself parts of conversations that are entirely inspiring and measurable in terms of the kind of impact we're seeing in the lives of the most marginalized communities in the U.S. At the same time, it puts this moment of peril in stark contrast. We certainly know that there's a lot at stake with the upcoming election when it comes to health equity. If you're not already kind of tuning into the issues of what's coming up with the election, I'm sure many of the communities that we serve are, and I think it's clear that there's no doubt that the election will have an impact. At the same time, there are also other consequences, impacts that we're already seeing. If we look at the Supreme Court rulings from last year, as well as the most recent term that ended a couple months ago or last month, the impact of the Supreme Court's rulings, regardless of the election outcome, already being felt in many communities. Recent Supreme Court rulings have now made it possible for some jurisdictions and others to more easily criminalize homelessness, for example. With certain other rulings, it's now easier to block and override governmental reforms for health equity. This is the Loper-Bright case. And we already seen some threats to marginalized communities in that regard. And we're also seeing in the judicial space increasing regulatory uncertainty because of what's happening there and risks of structural harm as well. So there is a moment to pause here and at least be concerned. And so in this moment when there's promise and also some peril, what does it mean then to belong? I think, as you were saying, Jacqueline, so beautifully, belonging for me means being able to form and maintain and strengthen social bonds with other people, not just friends and family, but with broader communities of like-minded individuals. And when it comes to the community of health equity champions, health equity leaders, represented by everybody on this call today, and the others that are in our networks, I think now more than ever, we need to forge the bonds that allow us to belong to each other and leverage that sense of belonging to be able to advance our work and to, of course, promote belonging in the communities that we have the privilege of serving and belonging to. So I'm excited about what this moment means. Why us? It's because health equity matters more now than ever, and there's great promise and peril. Why now? Because of the work that's been done in the past, this organization and the organizations represented by the core partners, as well as most importantly, your organizations, what each of you have been doing for many years in your own communities, in your own institutions. This represents a time and a moment to start to refresh our commitment to the communities we serve and to this broader shared mission of health equity. And I think the HECC allows us the opportunity to find common alliance, to break bread, and to, more importantly, redistribute power and resources to ensure that health equity advances, regardless of the election outcome, and in particular because of what's happening at the federal, state, and local level. So I'm excited, Jacqueline, for this moment, as you can tell.
Yeah, certainly. That was excellent, Rishi. And, I certainly agree with you. There are threats at all levels, and we can see it no matter which way we're looking, whether it's at the upcoming election, the policies that are coming out from, or the decisions that are coming out from the Supreme Court. But this is a crucial moment for us to really harness those relationships, as you mentioned, to make a stronger commitment for our communities. So yes, certainly. And, I want to go over to Denise and kind of hear from you about, well, actually, I think I'm jumping ahead of myself. I think we want to ask the community here, the people that we have in this space, about their preferences, about how we want what they prefer as far as getting involved and sharing some of their opinions. So this is one of the polls that we'll be doing today. We have a couple of others, but the question is, how do you prefer to share thoughts and collaboratively work on health equity topics? Maybe it's through joining working groups, participating in webinars like this one, sharing research and data collection, or sharing best practices, engaging in community outreach and education, maybe partnering independently with other organizations or providing feedback through surveys. You can feel free to look at that list and click all of those that really apply to you and your preferences. And if you have an idea that's not up there, feel free to put that in the chat. We'll give just a moment. If you aren't seeing the poll pop up on your screen, you might look at the bottom of your Zoom screen to see if you see a poll icon. And if you don't see it there, then feel free to drop your preferences in the chat as well. Okay, maybe we'll give just another moment and hopefully we'll be able to see how that poll turned out. Great. So I see here we're really spread out across the board, but 77% of you did say participating in webinars and meetings like this one is your preference and maybe why you're here today, right? Then that's followed by joining a working group, sharing best practices and resources, engaging in community outreach and education, and also providing feedback via surveys. And we also had about 50% of you also saying focus groups or small group discussions. And maybe a third of you, almost a third, one-on-one conversations, independently partnering with other organizations and contributing to research and data collection. Great. So a little bit of everything, which is great to have in a collaborative, right? So thank you for that. All right. And so now, I want to go over to Denise. Actually, I think it's the time. Hi, Denise. All right, and I'm just wondering, Denise, could you share a few examples? I know you've been involved in this collaborative when we first started, even before we even launched the Vaccine Equity Cooperative. And I want to hear from you some of the examples of how community input has shaped not only the Health Equity Community Collaborative's vision and mission, but even when we were the Vaccine Equity Cooperative. What have been the successes that we've seen that highlight the importance of this collaborative approach that we're trying to maintain in this collaborative?
Thank you, Jacqueline. First, I think folks know I love to give some shout outs. So I see you. I just want to say I see so many of you scrolling through the names, and I'm so blessed and honored to share space with you all today. I just want to honor your leadership. I know what it means to take an hour, right, away from your day to be present here. And I pray that you are nourished, right, that you get something, but that you also recognize as a leader, there's always an opportunity for you to give. And I see you all sharing and, supporting one another and affirming one another in the chat. That's what leaders do, right? My moment here is to talk about what we've been able to do together as leaders. And what I want to say is, and you've heard me tell this story before, I'm a young leader. I'm sort of a strange leader, and I'm also a leader who grew up in the midst of COVID-19, right, in the National Association of Community Health Workers. I found belonging, I found partnership, I found purpose, right, here in the HECC. I am a core partner, And what I'll talk a little bit about is sort of how we got here and what we've been able to do with so many of you on the call. But I can't miss the opportunity just to say, as a leader for each of you, you are showing up courageously, you're showing up consistently, you're showing up compassionately, you're showing up collaboratively. And I know what it takes to do that, which is why I hope you feel I'm trying to extend my love, my gratitude, my celebration of each and every one of you. Okay, so someone will share the slide. So let's get into it. I want to talk about this very diverse community and what we have been able to achieve together. One of the things that Jacqueline, should I share the slides or someone will bring that up?
It's coming
Yeah.
up now. Sorry for the delay.
Yeah, no, we're good. We're good. I just know I want to use my time well. One of the things I want to say, the power of diverse leaders coming together through the Vaccine Equity Cooperative, the Community-Based Workforce Alliance. These were the foundational communities upon which the HECC has grown and developed. The National Association, we have been able to work in partnership with all of you as partners in this large and diverse community. And what I want to say is that we have some wins. We have shown that we have been able to work together as diverse leaders and diverse organizations. And so in about a minute or two, I want to share three things. Number one, I want to say we've been able to work together tactically. We were able to come together with the trust and the partnership of the White House to pull together over 7,000 of individuals. Many of you are represented here on this call, and so many others that came from different communities into the Vaccine Equity Cooperative to say that you would help in this large and very rapid initiative. We were asked by the White House to come together, and through your leadership, through the community trust that you were building on and nourishing, we were able to come together and have over 2.5 million visits to our COVID website when these rapid at-home antigen tests finally were available and accessible to everyday people. We had, in a matter of days, over 650,000 households that gained information and insight into this free opportunity. And you helped us to get the word out so that test kits were ordered and that information was delivered in over 7 different languages. I want to go quickly to the other two just examples that I want to lift up here. We also were able to, next slide, please. We were able to come together in the leadership. And here I just want to call out one of our great core team leaders, such a visionary, Alex Quinn, right? My sister, mentor, and friend. The Vaccine Equity Cooperative and the power of the HEC also came together to convene when there was a significant gap in leadership around the issue of vaccine uptake and readiness, access for children. The HECC came together and became a convener. And many of you on this call, I see Scott was on this call. There are so many that I'm going through the chat to see. Many philanthropic organizations came together, school-based health centers, right? Many thought leaders, primary care providers, CBOs came together to lift up national recommendations that were utilized in the last several years to prevent, right? To ensure access, to drive racial equity, to acknowledge gaps in partnership, in relationship, in funding, right, across the continuum. On behalf of children and vaccinations that were needed across many, many different sectors. I've put some of the links here so that you can look at more. But central to that discussion included many recommendations around the power and the necessity for local community-based organizations, clinics, trusted messengers, members of the community-based workforce to be funded, right? To be resourced. In other words, thinking holistically about the infrastructure and the relationships that were needed to do this work. This is another example of the power of the Vaccine Equity Cooperative. And then finally, something that so many organizations took part in. I literally couldn't, I don't even think the images that I'm sharing here are doing justice to what we were able to build. But one of the first, and I think one of the most innovative, critical platforms that was developed by this community was the acknowledgement that each of you, your organizations, your expertise, your cultural communities, your insights, your lived experiences gave an opportunity for us to bring those out of local communities and onto a national platform where other communities who live like you, look like you, share some of the same barriers, assets, challenges, were able to come together and say, I want to share my toolkit, my comic book, my podcast, my training, my infographic, my campaign, right? And a platform was built where people could search and find this information. It was made freely available. And I just want to celebrate all of you who contributed. I want to celebrate the very diverse community advisory who vetted these resources and this information, and all of you who leveraged this information. This was freely available. And as a result of this and many other efforts, of course, it takes a village. Today, over 70% of the US population has received at least one COVID vaccination. So we've shown that we can come together across geography, ethnicity, race, language, sector, right? Lived experience, even organizational type, right? For the greater good, for the public good. And I'm thrilled to be a core partner and to think with each and every one of you about the future of the HECC. Can I give you one more? Our name, the name of our organization, was something that we, the core partners, did not want to, right? Talk about fear and trepidation. We did not want to bring this out of our own minds and spaces, but we asked you, and I believe over 1,000 people voted to bring us here together under this umbrella. So again, I want to thank each and every one of you for being present, for being with us, for all that it takes for you to be a leader in this time and in these times, and for your valuable contributions in advance as we build. Thank you so much, Jacqueline.
Thank you, Denise. And you're right, right? The proof is in the pudding, right? We don't know it's possible when we really collaborate, not just authentically, but organically, right? When things just make sense, it makes things possible that we maybe had not even seen was imaginable or even possible. Researchers out in the community, partnering with schools and health departments and philanthropy and businesses, right? Under a common goal. We even spotlighted communities that had invaluable work going on that may not have been spotlighted before. And that's what this is really about. And as you said, we see you. And I see Julissa in the chat, right? Keeping the fire going. And I think we have another question we want to drop into the chat, really just continuing that reflection that Denise shared, reflecting on the past few years. We want to know some of the ways that you've been involved. Whether it's in the Vaccine Equity Cooperative or leading up to the evolution and the launch of the HECC, how have you been involved in the past 2 years? So feel free to reflect on that with us and drop some things in the chat as we move on to Alexandra Quinn. Alex, I'm going to wait for you to get up on the screen. I know we're maybe I'm talking too fast. I'm getting excited too, so I need to slow down a little bit. All right, Alex, in the light of the current social political climate, why is it important for us to build upon our movement now and at this moment? And how can we ensure our efforts are sustainable and impactful during this time?
Thanks, Jacqueline. I'm so excited to be here. Let me start with that. Jacqueline, thank you for facilitating. There are so many of you that have been part of the past few years, both in the core partners, in our working groups, showing up to webinars. I see folks who ran their own collaboratives that we worked well with. The way I'll answer that question is twofold. First, all of this came from, and I'd be curious, and I got a chance to read everybody's name in the chat, and I think I gave a high five, but it may be looking like I'm raising my hand to your chat. I think a few years ago, we came together before COVID, really to question, how does our sector work? How does, not only the nonprofit sector, but public health, healthcare, so much of what we're asked to do is to work in silos. And this idea that any one organization or person or healthcare system is going to solve health equity just seems ridiculous, I think, probably to everybody on this call. And that's why we're here. So while myself and Denise and Rishi and other core partners and Jacqueline will talk a bit in this call, we actually want to hear from you and co-create this next phase with you. So what you'll see is we have some loose ideas and goals for the next phase. But like with the name, like with the working groups, like with the polls, we're interested in doing something that I would venture to say no collaborative has tried. I probably am wrong about that. So if you are trying, let's collaborate. But how do we actually grow a tent and co-create over thousands of people towards the idea of eradicating health inequities? And that's all we're trying to do today. And so in the current landscape, I think as someone wrote, it's not like we're out of COVID. I actually had COVID a few weeks ago. I know many others that did too. It does feel like, as some of you have put in the chat, that where equity is trying to be taken away, or we're not supposed to use the word, or we're not supposed to do X, Y, and Z. And that's why we wanted to strongly put a stake in the ground and say, how do we work together? How does HECC not only be a gathering place and a tent, but let's learn more about what every single person on this call in our community is doing so that we can support you. So the plans are loose with kind of big aims, and we want to fill in the gaps with each one of you, which means coming together in moments like these and all the other ways you told us. I loved the spread of how you like to collaborate. And really, for me, this moment requires deep listening, loose plans so we can work together, really good strategy, but lots of trust and shared values. And that's what we're trying to build here, a place that each one of you may want to come to, may want to belong, may want to co-create, work with us, help us shape the future. If we stick together, it's going to be harder to pick us off. It's going to be harder to not meet the big goals we have and kind of what we may need to care for each other. I'll end with, I've had a rough few weeks. I'm sure I'm not the only one. My mother sadly passed away a few weeks ago, and it was a systems error once again. And so how do you reckon, and I am not alone in dealing with hard things, death, being so disappointed at this current system that once again we're letting down someone in our own family. Maybe we're letting down someone in your family. And to me, that's why we're here. We are here so that we can make sure that there is no one in any one of our communities that is once again let down or taken advantage of or not served by our systems of health. And that's why I'm excited to work with each one of you and why I'm excited to learn with you too.
Thank you,
Pass it
Alex.
back to you.
Also sharing, just gratitude for you sharing what you're going through, and condolences as well. But as Alex had shared, we are really dedicated to creating a space where we can foster healing, collective care with one another. Again, this space of belonging and really building up power with our communities, which is really that foundation for health equity work that we want to push forward. So given what we've heard today from our core partners and about this sort of ongoing movement, we are eager to hear from you all. So we want to keep this moving and move on to our breakout sessions so that we can be sure to make HECC a genuine and unique space to support one another. So as Denise mentioned, your input has been invaluable to us in shaping the efforts of the Health Equity Community Collaborative. And we want to know your responses to a few other questions, right? We have two poll questions that are probably already up on your screen. So please take a moment to participate in this poll that we are launching to understand your focus and the challenges that you're seeing. So the questions are, what is your main focus of work in your community right now at this moment? You can again select all that apply within this first question. And on the second question, the question is, what are the top 3 health equity challenges that you most like to see HECC address to support organizations like yours? And again, please, it's multiple choice, but you can please select 3, your top 3. May be hard to choose just 3, but that's what the question's asking. And if there's anything else, you can also feel free to add things to the chat as well. So we'll take a moment for you to respond to those. And thank you, Cheryl, for completing vaccine series. That's an important one, right? Some of us have stopped and we really need to keep that going. So that's really important. Thank you for sharing that. And some of the options here, there are several options, right? Access to primary care, mental health, and social determinants of health or social services, health equity and reducing disparities, all the things. Okay. So we'll probably see some results pop up in just a moment. But while you're doing that, I'm going to take a moment to talk a little bit about the breakout rooms so that we're ready to go into those. So we do have 5 or 6 breakout rooms. You'll know when you'll get into those. But this is for more in-depth discussion of what we've heard from our core partners, but also just a few other questions about what things that are top of mind for you, particularly the election, which was mentioned, I think, by Rishi. So you'll be in a breakout room with one of our core partners that you just heard from, Alex, Rishi, or Denise. We also have Megan Puzaki and Suma Karan as our facilitators as well. So you might be in a room with one of them. And you could also even remain in this main room. So you'll want to remain in the main room if you are listening to the Spanish interpretation. Maybe you're joining by phone and not able to select a breakout room. Or maybe you prefer to process individually and add your responses to the chat instead. And so we certainly understand that, and we welcome you to remain in this main room. To do that, you'll just click Not Now when you see the Join Room pop up on your screen. So are we ready to go? Oh, actually, we have the results of the poll. So let's look at those real quick. We had about 64 people as far as, or sorry, 64% or 63% of people with our main focus of work looking at social determinants of health. We actually had 80% of people looking at health disparity and reducing health disparity. So those kind of go hand in hand. 40%, around 40% of people looking at mental health, working on mental health services and well-being, access to primary care, as well as local community and or public health workforces, and a fewer amount of people, maybe around 15% or less, looking at the COVID-19 recovery and related vaccination efforts, as well as environmental health and climate change. And then when it comes to the top 3 priorities right now, the top 3 that rose to the top were building connections to peers and organizations for collective advocacy to shape local, state, and national policy, and that's great. Accessing funds and support for collective community-based health equity focused advocacy and organizing efforts, and also responding to reduce institutional budgets and decrease political will for health equity work. Yes. So thank you all for participating in those. And I believe now we may be ready to move into our breakout room. So again, click join room if you are okay with joining in a smaller group conversation. you'll see the dialog box pop up and you can click join room to go into those rooms. Otherwise, you can click not now and remain in this room. Welcome back, everyone. If there were any responses that you're thinking about, wanted to share, or any other comments that you kind of feel compelled to share, we do welcome you to drop those responses in the chat. All right. Hopefully we are all back now. Hopefully, as I was saying, hopefully you had an opportunity to jump into some of the questions, get some good discussion in. I know in my group, we were only scratching the surface, and I feel like the time just went by so fast. But we do have a moment to just get maybe a takeaway from each facilitator. We'll try to get it in. I know in my group, we just really talked about sort of loving the opportunity to have some rapid fire consensus around different topics like we were doing today, as well as having some of the work be done ahead of time as far as knowing who are people I can partner with and get on the same page with when it comes to doing advocacy or health equity work, so that we can really just jump in and do some co-creation and work rather than taking the time to taking a lot of time to be thinking about it. And so really jumping into that immediate work. Thank you for the comments in the chat. Any other facilitators want to share maybe some takeaways from your group?
I can share. We had a great conversation, appreciation for the whole group. I think 3 things. One, how do we support each other in fundraising? And personally, I believe fundraising should be a team sport. That's one of the places we get pitted against each other. And instead, what if we work together? The other was how do we have some kind of way to share ideas, whether it be a hub or a platform or some ways so you can learn from each other. And the other was, how do we become less siloed and get supported as leaders? That was 2 of, can we actually make connections within groups so we can learn from each other, and what's the support needed for your own leadership? So great conversation, deeply appreciated.
Yeah, thanks, Alex. What about you, Sue? I saw you say appreciation to your group. What takeaway would you share?
I mean, there were a couple of really good ones, but one we talked about as a group about talking points. How do we equip folks to help communities understand how to vote in their best interest in the upcoming election, like around social determinants of health? Like, how do you have that conversation? Some really good ideas around communities of practice, staying engaged, different hubs around different topics we might want to cover, and resource sharing. Some good examples of other groups that are meeting monthly or quarterly to kind of keep energy going. And so there was a lot. We were kind of all over the place, but a lot of really good ideas.
Excellent. Thank you. And I see Denise's comment in the chat. Thank you about sharing about policy and funding impacts. Maybe one other facilitator, Rishi, maybe Megan, either of you want to share a takeaway?
Yeah, I can quickly share. We had, hearing Alex and Sue, your points, I was like, oh my God, our conversation was really similar. And I think the one thing I would add is we also talked in our group, just knowing there's so many different coalitions and associations and groups and organizations out there all doing similar work. And so how do we break down those silos and all come together and continue building this much bigger tent to really leverage all of our collective power to make change? And so, +1 to everything else everyone shared. That was just really fun and great ideas all around. So excited about all of this.
Yeah, thank you. All right. Well, again, thank you all so much. Thank you to Rishi, Denise, and Alex for sharing your insights today, as well as Megan and Susan for facilitating some of our conversations as well. You will see just a post-webinar poll pop up on your screen. But as you're doing that, I'm going to share a few quick announcements before we close out. So the first thing I want to share is that we do have an upcoming conversation or meeting with the Community-Based Workforce Alliance, or the CBWA, happening on Wednesday, August 28th at 3:30 p.m. Eastern Time, 12:30 Pacific Time. We are focusing on federal election implications for community-based workforces. And so we invite you to register for that conversation using the link in the chat. We also have an ongoing belonging survey, and we are looking to close that at the end of this month, but we would love to get some more responses So it's just, I think, maybe 4 or 5 open-ended questions. So we'd love to get your responses in that belonging survey. And then we also welcome you to save the date for our webinar with the NAACP Legal Defense Fund happening on October 22nd. And that will be at 1 p.m. Eastern Time. And so please save the date for that, 1 p.m. Eastern Time, 10 a.m. Pacific Time, I should say. But save the date for that webinar. There's more information to come in our newsletters and on our LinkedIn page. So feel free to follow those to stay up to date. And lastly, you see a QR code there. So if you or someone you know is interested in making a contribution to help sustain this work going forward, if you just want to help us spread the word to engage others or encourage others to support this collaborative, there is a QR code there on the screen and a link in the chat. That would take you to the Health Equity Community Collaborative's campaign page. So as you all know, being in this work, any gifts of any amount are really meaningful and appreciated. And yeah, we just thank you for that. And so again, thank you to everyone who attended today. Thank you for all of the questions, all of the responses in the polls, and participating in the breakout room discussions. We really, right, value your feedback. And as I mentioned, we'll be sending out a copy of this recording to everyone who registered today. And we wish you a great rest of your day. We hope to see you next time. Bye, everyone.
Thank you, Jacqueline. Thank you, everyone.